for staying with us. We have Kathy from Trinity on the line. Good morning, Kathy. What's your question?
Good morning. My question is, what are some of the signs or symptoms of prostate cancer?
Well, they are very similar to the symptoms of benign prostate hypertrophy, which means that you have difficulty emptying your bladder. You can't fully empty your bladder. You tend to dribble at the end of urination. And you, and by you I mean obviously men, have to get up more frequently at night. Generally getting up more than 2 times a night is kind of a red flag. And then these men will get examined by a physician, and they may have a nodule or a bump on their prostate gland and an elevated PSA.
And how do they detect it? By doing PSA test?
PSA is it's a rough screening test, but the main thing that they do is they go ahead and do prostate biopsies. And of course that was the basis for the Dean Ornish study, being able to monitor these prostate tissues that actually changed as people changed their diets.
And it seems pretty simple, doesn't it, to eat better and you're healthier all the way around.
That's absolutely right. That's absolutely right. Your body responds to how you treat it without any question. You turn genes on and you turn them off every single day. There are a few drugs that do that. For the most part, it's lifestyle changes, nutrients, supplements, things like that really make the difference.
All right, let's go to Gibsonville where we have Mary standing by. Good morning, Mary. What's your question?
Yes, I want to ask about, I got a kidney stone, and it's stuck in the urethra, and I was going to have surgery in February because it's been there about 10 months. And sometimes I have a lot of pain that I can't hardly walk. And I wanted to know, would that do any damage, keeping the kidney stone, or should I have it removed?
Well, I don't think you mean it's in your urethra. Your urethra is the 1-inch tube that drains your bladder and goes to the outside. It's probably in your ureter, which is between your kidneys and your bladder. The big problem with that is it's going to cause irritation of your ureter. It may cause a lot of pain and discomfort for you. But the other big problem is because it's hard to get urine past that stone, you have a much increased risk of getting infection upstream. So I'd go ahead and do something about it. I don't know if it would be worthwhile taking magnesium citrate. Magnesium citrate can melt kidney stones, actually, if you take enough of it over a period of time. But it depends upon how large the stone is and exactly what kind of stone is, because that only works for certain stones. Follow up with your urologist. Go ahead and get it out of there. Good luck.
Let's go to Sally in Burlington. Good morning, Sally. What's your question?
Yes, my niece, she has colon cancer, and I want to know, is it curable? And also, what causes it?
Oh, there's so many new treatments for colon cancer among conventional treatments. Things that can cause it or associated with causing it certainly are lack of folic acid, lack of calcium, a low fiber diet, not having enough roughage in your diet, and not having enough of the various nutrients that the colon needs to be really healthy. So moving your bowels each and every single day, making certain you have folic acid in your diet or in a supplement, and calcium all help prevent it. In terms of treatment, it's usually a combination of surgery to debulk the tumor, to reduce the amount of tumor that there is, and then possibly radiation or more frequently chemotherapy, and there's some very good chemotherapy agents. There are also non-conventional treatments like high-dose vitamin C. And this is done by several physicians in the state of North Carolina and is available throughout the U.S. There are a number of other treatments, but that's the one that I'm most comfortable with, where you use vitamin C actually as a chemotherapeutic agent. It actually acts as, it kills cancer cells in very high doses.
Let's go to Jeff in Greensboro. Good morning, Jeff.
Good morning.
Good morning.
Yes, Dr. Vaughan, I have a question for you about my mother who has Parkinson's and some dementia. We've been through the neurologist and all the avenues I feel like we can go through, and I wondered if it would be worthwhile to bring her in and let you evaluate her. That's basically my question.
Well, how old is she and how long has she had these symptoms?
83, diagnosed with Parkinson's in 2001.
And how about her dementia? How advanced
Dementia
is it?
started after a fall, more or less.
Okay. There's a lot that you can do with alternative care for people who have any kind of neurodegenerative disorder, whether it's ALS, Parkinson's disease, or Alzheimer's disease, or other kinds of dementia. The basic things that I or any integrative physician would do would be to look at toxins. Does she have mercury on board? Does she have lead on board? Are there other toxins we can get rid of that would allow her brain to start healing itself? What kind of nutrients does she need that she doesn't have enough of? And lastly, what are the different foods that would optimize the functioning of her brain. I use all kinds of IVs like IV glutathione, and then I chelate people to get rid of heavy metal toxicities and get very good responses. There are other doctors in the community who do the same thing. Good luck.
Let's go to Siler City where Ben is, and he's our final caller this morning. Good morning, Ben.
Good morning.
Good morning, sir. What's your question?
I was wanting to know what causes warts and what in the world can you do for them?
Warts are so frustrating, and I know that there are some interesting things that you can do on a natural basis to help them. Usually they're caused by warts. Usually they're caused by viruses, I'm sorry. And I think the things that you can use over the counter like Duofilm, D-U-O-F-I-L-M, which is an acid that is actually, it's tape that actually is impregnated with an acid, and you cut it out and you just put it on the wart, and it's just the right size for the wart. That frequently will eat away the wart over time. Increasing your vitamin C, taking plenty of zinc, all of those things will help in getting it frozen, getting it taken care of.
All right. Thanks so much for coming in.